Hello everyone, I'm Dr. Garima Agarwal, consultant nephrologist and transplant specialist from Manipal Hospital Varthur Road.
Hi, I'm Vani. I'm clinical nutritionist for Manipal Hospital Varthur Road.
So food is a very important part of kidney disease management. Patients of CKD or chronic kidney disease have a lot of confusion about what to eat and what not to eat. This is why we thought today we'll bring out this discussion about the ideal diet for kidney disease. We know a lot of online resources are not helpful because they are catered to the Western diet. So Vani, let's jump right into the meaty stuff. What is not to be eaten in CKD?
Right. So a renal diet or a CKD diet is something that has to have a less onto sodium, potassium, phosphorus, and there will be a fluid restriction. So why we need to go for a renal diet is basically to keep all the electrolytes and minerals in a normal range.
So talking about electrolytes, we know that when a patient is affected with kidney disease, they are not able to remove ideal amount of potassium from their body. This leads to high potassium in their blood, which results in variations in their pulse. It can lead to severe weakness and even sometimes cardiac arrest. Additionally, CKD patients are often on certain medication which also cause a high potassium. This is why the importance of diet which is restricted in potassium is so important. So Vani, can you tell us about a good diet which is restricted in potassium?
Yes. So any CKD patient who is having a high potassium in the diet. So high potassium food is mainly consisting of having lot amount of fruit juices, packed fruit juices, coconut water, taking millets like ragi, or having too much of tomatoes or too much of spinaches. So these are the high potassium rich food that is generally we see it. So a CKD patient who is taking a high potassium rich these kinds of food can lead to the medical issues like what Dr. Garima has said. So to cut down onto this potassium in the food, there is a process called leaching. So leaching is one thing that we can add on.
Okay, so can you tell me a little bit more about leaching? What is leaching?
Yeah. So leaching, it is a cooking method which we have to do it as a pre-preparation. Alright. So any of the vegetables, pulses or legumes has to be soaked in water at least for 2 to 3 hours, and then that water needs to be discarded and again refill the water and keep the fruits or vegetable or pulses or legumes for another half an hour, and then it has to be gone for the cooking. So while doing this leaching process, at least 50% of the sodium and potassium will go away.
Okay, so that's some way that they can eat the fruits and vegetables of their choice. Now, we know that chronic kidney disease or CKD patients often have high blood pressure, and in advanced stages of CKD, patients also get fluid collection in their body. This presents as swelling on their feet, around their eyes, breathing difficulty, and even a very high blood pressure. So and also we know that sodium or high salt or high fluid intake makes all these things worse. Are there any tips you have on how to restrict these?
Yes, so the common salt or the table salt is the best for the CKD patients. That too, it can be an iodized salt, because in the commercial market we see a lot of different types of salt these days. Something which contains low sodium, but that sodium salt may have high potassium at it. So the salt restriction is very important for a CKD patient, and it should not go beyond 3 gram. So now how do you identify that, or how do you understand that you are taking 3 gram of salt? So 1 teaspoon is 5 gram. So less than that, if we are keeping it like a half a teaspoon for the entire day, that we can consider this as a 3 gram of salt. Or you get packet of 1 gram of salt which can be distributed throughout the day, like 1 gram for the breakfast, 1 for lunch and 1 for dinner. So this is one tip which can be added for the patient's diet. The other way is to add lot of condiments and spices and herbs, where they can actually add more taste onto the diet or onto the dishes, like adding vinegar or ginger garlic, or putting some spring onions and so on, will help definitely to reduce or match the absence of the salt.
Now, what about fluid, Vani? There are patients who we advise that they should not take more than 800 ml of fluid in a day. So, how do you advise them? Any tips?
So, doctors generally advise 800 ml per day. That is the normal that in all CKD, the yes in CKD, advanced CKD. So, this 800 ml has to be distributed again throughout the day. So, all the cups and utensils has to be like 100 ml or less than 50 ml cups can be utilized, and a measuring cup or jar is one of the best way to measure how much of fluids is getting into the body. And second is avoid taking too much of spicy and salty food, because as you take lot of spices and salt, then that increases your thirst, right? Yes, water intake, and try to use cold water where it reduces the thirst. And last but not the least, try to rinse your mouth quite often. That can also help to reduce the thirst.
So, when we talk about CKD diet, the biggest confusion is about protein intake, and people hear from somewhere that they should not eat protein, or somebody misadvises them, and we see that patients stop eating all protein. While it is true that kidney disease patients should be eating less protein than a regular person, and animal proteins are more harmful than plant proteins, but we also know that if patients restrict their protein too much, they are more prone to malnutrition and really poor overall health. So, Vani, what are your suggestions on optimizing protein in CKD patients?
Right. So, as Dr. Garima has already told about this, Indian diet is basically having a low protein. So, a person who is on CKD should not take too much of animal protein. So, that is consisting of taking red meats like mutton, pork, or any kind of processed food to be completely avoided. And the recommendation is just 0.8 to 1 gram of kg of ideal body weight of protein a person has to take for the entire day, right? So, if a person weighs like 60 kg, should not take more than 70-75 gram of proteins for a CKD who is not on dialysis. So, those people have to take only 50 to 55 gram of proteins. So, that should be from the plant source. So, plant source you can always try taking paneer, try having tofu or soya. The main advice or the main suggestion which I would like to give is, do not take any supplements, mainly the whey protein, whey isolate, casein and so on. In case a nutritional deficiency is being seen, you can always keep in touch with the doctors and with the professionals. That is one advice for the public. Yeah.
Now, last but not the least, this is what patients ask you and me. Doctor, you have restricted everything, what can I eat? So, Vani, can you tell us, like in very short, like what can CKD patients eat without worry and guilt?
Right. So, as I have told before also, we need to look into low sodium, potassium, low phosphorus, and definitely fluids. So, from the cereal side, you can always go for brown rice, take semia, take sagu, try to have vermicelli, try to take rava, try to include wheat and wheat products in the diet. So that is from the cereal per se. When it comes to pulses, try to have moong dal most of the time and restrict on to the urud dal or masoor or tur dal. The leaching process is very important in every step, even if a person is taking a low sodium or low potassium. When it comes to fruit, take one fruit a day. At least try to have apple or 5 or 8 pieces, diced pieces of papaya, or consider taking berries whenever that is available in season. You can always take jamun, and these are the main low potassium fruits that a patient can take it. And oil can be taken in the fat can be taken in the form of oil. So try to have canola oil or rice bran oil for the fat, because do not avoid taking fat. Fat is also important for your metabolism and for the fat soluble vitamins to get absorbed. So these are the main points a CKD patient has to keep in mind. And definitely the protein, plant protein is highly recommended than the animal protein. Eggs can be given, but not the egg yolk. Try to take egg white in the diet, and the portion control and portion size is very, very important when it comes to protein. So these are the main suggestions which I would like to give.
Thanks for that, Vani. And I think I will conclude this session with just one comment. Please consult either your nephrologist or a trained dietitian regarding a kidney diet. Don't read things online or take suggestions from untrained sources. Thank you.